Okay, so let's first of all give a few people a chance to jump in. I see we do have some people jumping in. Let's talk a little bit about, as we always do, the articles that we published on the Oldish this week. So really the sum total of this is drink less, lower the salt in your diet, and coordinate your brain waves for better sleep. Is anybody surprised at that? I'm sure not. You know, those articles are all there for you to read, and they're based on the latest studies. The coordinating your brainwaves thing is sort of interesting. It talks about how when you're asleep, your brainwaves are sort of off kilter and they cause you to have sleepless nights. It's interesting research, so go take a look at that. If you do all of this good stuff, stop drinking, which means not having very much fun anymore, lowering the salt in your diet, which is a good thing. What we learned from this overall is that your cognitive function should slide less as you age. Our most popular article by far, though, was our article on end-of-life music therapy. That was all about using music to bring peace and joy to your loved ones in their final days and moments. And, you know, it was shared over 150 times on our Facebook page. It brought a lot of really heartwarming comments to both our page and our private messaging. People who would tell stories about holding the hand of their loved one as they slipped off, and they'd be singing hymns. The family would gather around. They'd sing some favorite songs. There was even one lady who posted and said that they brought in a little rock combo because that was the music that her brother listened to in his 30s and 40s, and that was the music that made him smile. So they brought in this little rock combo and played that music. So it was wonderful. We also posted the other day a really interesting documentary, and I'm sorry to our readers in the US, you won't be able to make use of this link, but if you're in Canada, there's a great CBC documentary called The Caregivers Club. It follows the journey of 3 different caregivers, and if you've got about 45 minutes, because it was originally an hour-long show, so no commercials, but if you've got about 45 minutes, it's really worthwhile if you're interested in some different views on caregiver journeys. If you haven't already, please like our page. If you want to stay up to date on our live show content, then up at the top, below the main picture, there's a little box that says following. Drop that down, and there's a choice that you can make that says see this content first. Facebook lets us all like and see first content from about 30 people and pages. So if you would like to stay up to date, I would ask you to click that. I do that all the time, especially when I know that events are coming up and I don't want to miss them. I click it, and then, you know, I might go back 2 months later after the event has happened and uncheck it so that I can add somebody else. But anyway, I would appreciate it if you would do that, and you can stay up to date on this, and especially up to date on the shows that we have planned with our featured guest today, Mara Gordon. We have about 3 shows planned, a little bit more on that later. Let me tell you a little bit about Mara. I've known her for quite a while, many years in fact. She specializes in the development of cannabis extract treatment protocols for seriously ill patients in California. She's the co-founder of Aunt Zelda's, Zelda Therapeutics, and Calice Spring Wellness. Prior to Aunt Zelda's, Mara worked as a process engineer, and she helped Fortune 500 companies develop intelligent software. But this experience has enabled her to take a detailed and scientific approach to medical cannabis. Because she never sleeps, and I'm sure she never does, she recognized a need for patient-focused software. So Mara founded CDR Med. And with CDR Med, physicians and medical health professionals are able to make treatment recommendations based on the latest high-quality data. Mara also sits on the boards of Zelda Therapeutics, Illegally Healed, and New Frontier. And because she's an incredibly busy lady and she has time in her day, she presents at all kinds of conferences. She's presented at multiple continuing medical education accredited medical conferences, along with inaugural medical cannabis conferences in Australia, Costa Rica, Chile, and the Czech Republic, as well as all kinds of events throughout North America. So I would invite you to welcome Mara Gordon to our broadcast.
Hi, good morning. Thank you for having me.
It's our pleasure. Absolutely, absolutely. Now, Mara is coming to us from the left coast, where I think it might be just a little warmer than it is here. It is what? It is -7 degrees Celsius here.
Oh, wow. Yeah, it's definitely warmer here. I don't know, I have to look and do my conversion, but it's about 57 here, something like that. So I'm not sure the conversion. I'll get it. I'll find it though.
Because you're a scientist, I know, that's okay.
Yeah.
Tell us a little bit about Aunt Zelda's history, Mara. Your history, your husband's history, who Aunt Zelda was, how this all began for you, because it's been quite a journey.
Yeah, it has been. I just want to very quickly though make a correction because I'm not sure where you got my bio. Thank you for the lovely introduction. But I no longer am on two of the boards that you mentioned, but I am on other ones that are very important to mention. One of them, I am on the Standards Governance Board and a founding member of the NACB, which is the National Association of Cannabis Businesses. And it's a self-regulatory organization nationwide, and it will eventually include Canada and other countries as well, on standards for everything from, everything, soup to nuts, everything on how, which seeds go in the ground to which medicines go into the body, and everything with the testing, manufacturing, labeling, et cetera. And that's a very important one that I'm very, very excited to be actively involved in. And then also Fundación Daya down in Chile, which is helping families that are suffering, that are trying to have access to medicines, that I'm very, very pleased to be doing work with them as well. And then CanPal, which is one that of course is very dear to your heart, which is where we work with animals. And we're doing preclinical and clinical trials on animals, looking at things like osteosarcoma pain in dogs and wound healing in horses and things like that. So this work is getting very, very exciting. So anyway, back to the other. So a little bit about my background and my husband's and everything. Stuart Smith, who you so fondly called Jim, and that's for another discussion on another time. In fact, at a meeting yesterday, he referred to himself as Jim, and because I had told him I was doing this with you today.
That's hilarious.
So I know, it was really funny. But I had stopped working back in what I call the real world, where pardon me, just getting over this flu that seems to be going around for everybody. But I just see one of my kids just popped on. Hi, Mallory. So I was had to stop working a number of years ago because I was my health had deteriorated so severely. And I had gotten to the point where I was on 26 separate pharmaceuticals, including fentanyl patch, which, as we just heard, fentanyl was one of the drugs that killed Tom Petty. Fentanyl has been responsible for so many opioid overdoses because it's such a dangerous, dangerous drug. So I was able to get off of it and all these other drugs, and I was left with chronic pain, suffering. I was still on a lot of pharmaceuticals and everything else, and I was looking for alternatives. I had just made the decision I was just going to suffer, which of course is not much of a choice, right? And then my husband, Stuart, has been, he was an athlete when he was younger, and he had broken his back pole vaulting. And he had been living with a spondo, which is like where your back's about, the spine's about to do this. And we had taken a 2-year road trip. And on that road trip, there was a lot of physical requirements, getting the thing popped up, then all the hassles of getting Peregrine up and going, our teardrop. And it had gotten to the point where he was either going to have surgery or he was going to be in a wheelchair. And the doctor said, you're going to be in a wheelchair very, very quickly. I was watching my husband get very old before my eyes, shuffling around, not lifting his feet, that sort of thing. But now, at this time now, he's been sober for 29 years. At the time, it was 21, 22, I think 21 when we first started looking. And he was not willing to go on the opioids that were required in order to do the surgery, because he knew from too many guys that once you're on those, you don't get off. And even though these opioids are well designed for short-term acute pain, they're inefficient and detrimental and don't work for long-term chronic pain. Chronic pain is its own disease. So in the researching, he started a friend of ours that we had also met on this road trip, mentioned that she was making pot brownies for her boyfriend, and that they helped with his neck pain, and so it kind of put a a thought in our head, and she came to visit. And once we had settled back in California, and I said, you know what? Let me just take a puff. You know, I hadn't smoked cannabis or had anything to do with it in so many years, and I was just like everybody else. To me, it was marijuana. It's a drug. It's no different than heroin. It's, you know, I didn't know that it was a gateway, but all I knew was everybody that had a drug problem also seemed to also smoke cannabis. I didn't, you know, I should have known as somebody who understands statistics that cause and effect aren't necessarily, just because they do both doesn't mean one causes the other. We could say heroin is caused by people putting on their jeans in the morning. I mean, it's ridiculous. So anyway, so when I saw what cannabis could do, I was so, at first I was amazed, and then I was furious that none of the doctors that either of us had been going to for all these years had said to us, this is an option for you. This is an option, cannabis. So we, of course, being who we are, we started doing it all very legally, and, you know, we went and got recommendations from doctors and everything else. And we came back. I didn't know anybody at the time, and this is the funniest part, is I didn't know anybody in California who grew cannabis. You know, now you can't swing a cat without hitting somebody who grows cannabis. But it was all underground at the time, or pretty much all underground. So I went up to Oregon and got a license up there and bought some from a woman and brought it back to California and made oil. Now, there was no directions, nobody to tell me what to do, because at the time there weren't the resources there are now. Now there are so many wonderful resources available, but there wasn't then. And so I just had to figure it out on my own. I accidentally decarboxylated, in other words, activated the THC. I accidentally heated it to the point to where it went from being a raw cannabinoid of THCA to THC, not even knowing that's what I was doing, but it was the right thing to do. And anyway, I ended up infusing it into oil. When I went looking for a recipe, because I wasn't big on brownies, on something to make, I went looking through my cookbook and I came across my Aunt Zelda's carrot cake recipe. And carrot cake, pardon? Yes, she's my Aunt Zelda. Yeah, she was my mother's sister, and she was twins with my Uncle Zelig. So yeah, it's my aunt. And so I went ahead and, because carrot cake's very oily, it uses a lot of oil. And so I figured out that I could control the dosing by understanding how much I put in and then weighing each piece. I mean, this was rudimentary. There were no testing labs then. And yeah, and so it just kind of evolved into becoming Aunt Zelda's, just because of, you know, people kept asking for that Aunt Zelda's cake, you know, that Aunt Zelda's. And then a very, very bright man said to me, I don't know how bright he was, but he made a bright statement. He says, why do you keep building everybody a house? Why don't you just supply them the lumber? And I started thinking about that, and it's like, that's right. I'll just make the oil and tell people how to use the oil. If they want to put it in a cake or a sauce or a salad, or just take it plain, which is what I recommend because it's better for dosing, then do that. So I stopped putting it in cake and started just making the oils. And that's how we got here.
Fantastic. I just want to, we've got some feedback.
Okay. Mm-hmm. Very, very good question. And I'm going to refer back to your introductory statement in doing so. You said something about cutting down on alcohol, and then we won't have any fun. Okay. Recreational is, a lot of it has to do with your intention. If I'm sitting down in the evening and I want to, of course, I don't drink alcohol anymore because I stopped sugar. So, but let's say I did. But okay, let's say I was going to sit down and it's like, you know what? I want to relax and I want to have a glass of wine. And I would pour that glass of wine and I would enjoy that glass of wine. That's recreational. If I did the same thing with cannabis and I said, you know what, I just want to mellow out here and chill, and I'm in a social, maybe I'm with another person or two, and I start, smoking something, or we all take something, and then we have an experience together, and I am doing it strictly to feel altered, then that's recreational. The way I look at cannabis is I want to take a therapeutic dose where I can accomplish what it is from a medical standpoint that I am seeking to accomplish without altering how I feel more than necessary, and so that I am capable of going about my regular life. When I go in the bathroom in the morning and I take my asthma medicine and my thyroid medicine and whatever, it's not my lifestyle. When I take my cannabis in the morning, it's not my lifestyle. I take my medicine, I put them back in the cabinet, and I go about my day. If at some point I decide to hang out with some people and smoke a joint, which of course is not something that I do, but if I did, then that's recreational. Unless I'm in terrible pain and I say, oh, somebody's smoking a joint, I'm going to take a puff so I can have immediate relief. So it's about your intention. Does that make sense? Mhm. I wish I'll give you a slide to use for next show that we can put up that shows some of these that I show in most all of my presentations. It's a slide that just shows like the various diseases that have been approved across the U.S. and Canada, the U.S. at this point. I don't have all Canada in there, but I think you guys are pretty much the same. But the endocannabinoid system is a regulatory system in your body, if you think of it that way. I'm going to keep it real simple, but its job is to make everything else work better. Sometimes people talk about it being, to create homeostasis within your body where everything's working together. So if you are, and then you have these CB1 and CB2 cannabinoid receptors in your body that are all in your central nervous system, in your peripheral organs, in your, and then you have the CB2 receptors that are primarily in your immune system and in your organs. So you can target these and you go, okay, where I have a disease or where I have a problem in my body, are there any receptors there? And with the exception of the brainstem, the answer is pretty well yes to most things. So since inflammation is one of the primary causes of disease, and inflammation is an immune response, and we know that cannabinoid receptors are in the immune system, anything that is affected with inflammation or immune can be targeted with cannabinoids, with cannabis in one form or another. Anything that has to do with the nervous system and has to do with nerve pain or headaches or anything like that, you can use for cannabis as a result of it. It kills cancer cells in various different types of cancers. So if you think about something, I visualize sometimes the endocannabinoid system spinning plates. It keeps all the plates spinning, and it works synergistically with many other conditions. So we have people that are using it from everything from chronic pain to anxiety to PTSD to sleep, sometimes for regulating moods. Sometimes people are using it for GERD and Crohn's disease, irritable bowel. I mean, there are just a plethora. It is really, it's an embarrassment of riches, and it's almost too much, because if it were for less, it might be easier for the medical community to believe it. Because how can something that's not be so good and be so beneficial, right? Right. That's okay. Ah, what is Kevin? Stuart's favorite cookie is anything that contains a lot of chocolate. Right. Right. Another very good question. Good question, Karen. So the first question you should ask yourself is, what is your tolerance for being actively engaged in your own health? And I truly believe that as a world, we are becoming much more involved in our own health. We're leaving it less and less in the hands of the doctor to tell us what to do, and more in the hands of exploring, with reading websites, going to seminars, trying different things. I see this a lot with functional medicine and naturopathic medicine and things like that, where people are taking it into their own hands. So the first thing is to understand what your diagnosis is and what it is that you actually have wrong with you. Okay? Because oftentimes people will come to us and they'll tell us what they think they're going to use cannabis for, and then you get halfway through and they're like, oh, and by the way, I also have X. So the first thing is you need to really have a full understanding of your intake, and I really do recommend that people have some sort of guidance, from a medical professional or somebody who has. I really want to have like a doula system where people are supporting each other in this, with people that actually do that. But you have to look at what other pharmaceuticals or medications you're actually taking already, and then look to see if there's going to be any kind of interaction between them. Well, it's in the software platform that I've built CDR Med. It actually is. We actually have it built into it, but you can do it on your own by Googling. It's not exact, and the reason it's not exact is because the system has a lot of different minutia that's better left to the scientists and the medical community. But there's the cytochrome P450 is an enzyme through your liver that many drugs, over 50% of all pharmaceuticals, are designed to metabolize through the liver and through this P450 system. If they do, then they can be either a prostrate, a substrate, or an inducer. They can either make the drug stronger, weaker, or ineffectual. And so what you can do is you can do a very simple Google search where you just put the name of the drug that you're taking and metabolization or metabolize, and then put P450. And P, yes, right. P as in Paul, 450. And just put that in there. And if it comes up and says, it'll show you a myriad of articles and whatnot on how this particular drug is designed to metabolize. And once you know that, you then have an opportunity to talk to your medical, because if you're taking a pharmaceutical, chances are you're talking to a medical professional at some point, to talk to them about either adjusting the dose, changing the pharmaceutical, or just being watchful to see if there's going to be an interaction. In very, very rare cases is it problematic. There are certain circumstances where you have drugs that perhaps will not act as well as they should, or they won't be as effective. But in the case of opioids, for example, the vast majority of opioids are designed to be metabolized this way. We suggest that people drop down half of a dose of whatever their opioid is right away, because otherwise it'll go in much stronger and it'll have a much more somnolent effect, which is not what people are looking for. Right. Absolutely not. Now, I can't speak from a legal standpoint, like how it is in Canada or how it is in another state in the U.S. or another country. To not speak to that, but to just speak from the standpoint of what your rights are as a patient, because there does need to be a patient's bill of rights around cannabis, absolutely, if there isn't already. There probably is, because it's amazing what I've been able to find out there sometimes. But if a person is working with a physician who is, I say there's two different kinds of doctors, probably many more, but two in particular. You have physicians who are tradesmen, who you come in, they look it up, they go in and they write the prescription based upon what the ICD-10 diagnostic code is in their directory, and then they send you on your way. If it says that you weigh this and this is how old you are, this is how much you take, they write it out, they give it to you. These are not curious physicians. Then you have doctors that I've been fortunate enough to work with, and I feel like I see in this industry, or that have been more interested in incorporating cannabinoids into it, and that is that they're scientists. They're curious, they're interested. And in Canada, correct me if I'm wrong, are you able to select your own doctors, or are you just given a doctor? Right. Right. So if your doctor is not supportive and you don't have options to go to a different physician, because as far as I'm concerned, if they don't support choices that are from all the real good science, I mean, it's the most studied drug in the world, then I suggest that they change doctors. Okay, because fire your doctor and hire a new one. If that in fact is not an option, though, then as long as you're being very careful about the interactions and the timing of your things, and you're being careful to see what the reactions are, it's not dangerous. There is no way to die from an overdose of cannabis because of the fact that there are no receptors in the brainstem. The brainstem is our lizard brain, where it's our respiratory, our all the things that make us, our gag reflex, our all the things that make us alive and keep our bodies going. That's why people will overdose from opioids and other drugs, is because it sedates, it down regulates the brainstem. Well, we don't have that problem. Now, there are other issues that can take place, because it can drop your blood pressure considerably, which can give you a rapid heart rate. And for somebody who has atrial fibrillation, that can be problematic. People that have schizophrenia, if they take too much, it can cause serious issues. I mean, there are times when cannabis is not necessarily the best solution. But because if you go back to the beginning when we talked about how inclusive it is in your body and its job, your body creates cannabinoids on its own. They're called endocannabinoids or internal. There's no reason that we can't take a phyto or a plant-based. Same way, if you're low on vitamin C, you might take a supplement, or D, you might go out in the sun or take D3 or something. So it absolutely isn't the end. Mm-hmm. Right, right. Absolutely. Well, I was on 26 pharmaceuticals, and now I'm on 3. But those 3, I couldn't live without. So, so I'm not against pharmaceuticals. I'm against the misuse and overuse of you go to the doctor, and oftentimes, this is something I've heard so many times, patients will leave a doctor's office, and if the doctor doesn't write them a prescription or send them for a test, they'll say the doctor did nothing. Well, that's why doctors end up writing more prescriptions, because people want, and so, but doctors always add, they rarely subtract. They rarely say, I'm going to take you off of this and I'm going to put you on this. They add something. Right. Right. So one of the things, first of all, this will be a lot easier for Canadians than it is for people in the U.S. And the first thing is cannabis is administered, bottled, etc., all in metric. So it's milligrams, it's milliliters, it's grams. It's all done in a metric, which to me makes perfect sense. It's absolutely the most logical. I love it. It's a little tougher for my, American cohorts, because they get milligrams and milliliters confused. They get milligrams with grams, it's a math problem and it's an educational problem. So that's the first thing, is to be familiar with that. Also to understand that there are over 100 different cannabinoids. THC, which is the one most people hear about as far as the one that they think of when they think of getting high, and they think of the stoner, and they think that, and it's really a shame that it's gotten that attitude, that kind of, that bum rap, because yes, it can be abused the same way any drug could be abused. Opioids, if used, for example, correctly, are fantastic. When they're used incorrectly, then it's not so great. THC has phenomenal medical benefits, and the psychoactivity, when you're using it medically, can be minimized by the way that you titrate and the way that you get to a therapeutic dose. Titrate means increase slowly. Like if you ever been on a steroid or something, or a hormone, where they start you on a very small amount and then you work up to what they consider the therapeutic dose, and then you stay there. Okay. Right. Now, I would just say that I don't consider it a bad effect. I would consider it an effect that some people might not want. But you know what? Feeling euphoria really is not a negative. It's just a negative if it interferes with your ability to drive a car or go to work or, function. Right. A lot of, it's a different. Exactly. Right. Right. So you have THC, you have CBD, cannabidiol, which is the one that got all the noise around it because of the Sanjay Gupta and the weeds and the Charlotte's Web and all that. But CBD is another cannabinoid with phenomenal medical benefit. Some people say that they have no psychoactivity from it. But I can tell you from treating thousands of patients that just is not accurate. Unless you're dealing, of course, with an isolated molecule where you just have the CBD. But if you have it in a whole plant, in addition to the over 100 cannabinoids, you have up to 500 different terpenes and flavonoids and other elements that are in the plant as well. And these things can very much alter how you feel and your responses. I mean, linalool, for example. Linalool is one of the terpenes that's very common in a lot of cannabis medicines or cannabis products. Linalool is also in lavender. Well, anyone that's ever gone for a massage or wanted to relax, they put lavender and it completely changes their mood. You have myrcene. Myrcene is in mangoes. It's very calming. It helps you to sleep. You have limonene. Limonene is in lemons and oranges and these things that's very uplifting. So the cannabinoid, think of it as inert. It's not, but think of it as just, it is what it is. And then what you put with it, or what's in the plant with it, will alter the way that the experience ends up being of that medicine itself. It's important to, I'm thinking of there's CBG, which is cannabidiol. You have THCV, which is of Varin, which we're doing a lot of very promising research on in things like diabetes, because it downregulates the insulin. I mean, you've got so many different opportunities within this medicine because there are so many different. You also have beta-caryophyllene. Now, beta-caryophyllene is in black pepper, and it's in a myriad of different things. And it's phenomenal because it can also activate the CB2 receptors without any kind of psychoactivity, but can activate them within your body. So next time you're having a salad and the waiter comes by and says, would you like some black pepper on that? You say, yes, please. I'll take my beta-caryophyllene right now on my salad, because it's very, very beneficial for the body. Yeah. And now, I mean, there's so many different things. Then I think we're going to be doing one of these on methods of ingestion, right? Where we'll talk about, yeah. So we'll go into all of the different ways that you can consume it, whether, from an external source, internal source, and we can go through all that because the vocabulary is quite extensive. I think that the thing to understand, though, from this point is a raw medicine is going to act very differently than a heated medicine because they have something. It's a acid molecule that's on them, and I'll make sure that we have a slide for you to put up next time to show. It'll show that it all starts out. It's an amazing plant. It all starts out as this cannabigerol acid. It has the CBGA. When all plants, all cannabis, and then as based on the genetics of the plant, it'll then convert over to either THCA or CBDA or all of them with the acid molecule, or CBGA or CBCA, any of them. Then once it's heated, this molecule is burned off, and then it can fit into the receptors for THC, and it acts differently at all the different levels based upon when they're heated. So it's kind of it morphs, and then as it ages, it becomes something else again. But each one of these have their own medical benefits in each of these, so that no matter what form you use it in, you're going to benefit. Yes. I mean, in one hand, I'll give you an example. On one hand, our topical we made with 10 essential oils in it, in addition to cannabis, THC-based cannabinoid medicine in there. And people will say to me, well, what's it good for? And I'll say, where do you have skin? Where do you have anywhere to put it? It's good for that. And who is Darlene? Somebody keeps asking about Darlene. I guess it's either you or me, Karen or Mara. But the medicines themselves, they can be used for a myriad of things. I mean, you have a bottle of medicine, and as long as you know what's in it, you can be directed in how to use it correctly for what it is you're treating. But it's not like pharmaceuticals that target one thing. It doesn't work that way. It is systemic. So it's not like you take this for this and it just works on that, and you might have side effects that affect the rest of your body, but it's only going to work there. This is something that has much more of a universal effect on you. But if, for example, somebody wants to sleep, let's say let's say they have insomnia, and they want, in fact, we're doing clinical trials right now on sleep with one of our formulas, and they're having difficulty. When you would look at the medicine, at the lab results, it's very important that you understand, because the labels in many, many cases are not telling you. They use words like energy or daytime or whatever, but because they're not FDA approved or TGA approved or any of the other around the world, they can't make medical claims. So you have to be very careful on the wording. But if something says something says energizing or something like that, that's not going to be something you're going to use for sleep. But if you don't have any of those clues and you just have the medicine, but you have the lab results, and you can look at that result and you can see, it's like seeing the ingredients on a label. And it says it contains alpha-pinene and beta-pinene and limonene and all these things. That means it's all going to be very uplifting. It's going to be activating. Those are not ingredients you want to have in a sleep product. It's up to us as professionals to make sure that we don't have to turn every consumer, every patient into an expert. But it is still participatory medicine where people are just going to have to be less passive than they have been, like they are with any kind of a naturopathic or holistic medicine. It's not like a doctor and they say, here, take this pill, and you have no idea, but it's the red one, so. Mm-hmm. Okay. The first thing and the most important thing is the first question you have to ask yourself is, let's assume let's start with a tincture or an infused oil. Okay. Let's go to the edibles and the things like that afterwards. Let's stick with like the tinctures. The first thing that you want to know is how many milligrams of each cannabinoid, whether it's THC or CBD or THCA or whatever, is in each milliliter of the medicine. So let's say it's got a dropper, and a dropper is 1 milliliter. You want to know how many milligrams that you're going to be getting of those cannabinoids from that 1 mil. If you don't know that, then you have no idea how much you're taking. And a lot of times you'll see a label that says 4-to-1 or 2-to-1, but it doesn't tell you, number one, which one is first and which one's second. Is it THC is 4 and CBD is 1, or is it vice versa? So that's important to know. And then also the ratio doesn't tell you how strong it is. It just tells you the proportions. So when I was very frustrated recently. I gave a talk at a senior community that I love speaking at. I've been speaking there since 2011. And I asked this woman asked a question because I was talking about some of the methods of ingestion and things. And she said, well, and I said, well, what are you taking now? And she says, I take 3 drops. And I said, great, 3 drops of what? Well, I don't know. It's 4-to-1. Okay. Do you know? And it was in this case, you would happen to be talking about THC being the 1. I usually say THC first, CBD second, because that's the way lab results are returned, and I want to standardize, but that's a tough battle. But I said to her, I said, okay, so you're taking 3 drops of a 1 to 4 of this medicine. How many milligrams is in each drop? Well, I don't know. So we've figured out, like, for example, in our medicine, we have them standardized right now. We're going to be coming out with some new packaging because of the new regulated market in California that's going to change some of this. But we've been doing it at 10 milligrams per milliliter of major cannabinoid and 50 milligrams per milliliter of major cannabinoid, because between those two, we can treat most diseases without an abundance of medicine being used. Because we know that 1 drop on the 10 milligrams per mil is 1/3 of a milligram. And on the 50, 1 drop is 1 point, I have to do the math again, but I think it's like somewhere around 1.5 milligram, 1.2 or something milligrams. Because there's 30 milligrams, so somebody do my math for me. 50 milligrams, 30 drops. It's important to know also how many, the bottle might say, 300 milligrams of CBD. Then it's up to you but it won't tell you how much is in a milliliter. So then it's up to you to actually have to do the math yourself. The other thing that's important that you understand is, has the medicine been lab tested to make sure that it is free of pesticides, microbials, mycotoxins, aflatoxins, solvent. I mean, some of the solvents that people are using are nasty. I mean, butane and isopropyl alcohol and things that you do not want in your body. You want to make sure that if you're using a product, that it is very, very clean and has been third-party independent lab tested. Also check for expiration dates. Make sure that this stuff is fresh. If it says, follow how, keep it in a dark, cool place like you would a fine wine so you can protect it. So, I mean, there's a lot of things that you can do, but ignore the key words that they put on them and go more towards reading the details of the label. Now, on the other hand, just one quick thing. I did mention about the alpha-pinene and all that not being used for sleep. But if a person has PTSD or OCD or ADHD, oftentimes the chemotypes or the profile of the medicine that would make you or me maybe jump out of our skin will make them feel very calm. The same way Ritalin or Adderall would be a speed to you or me, it might make, I assume me, I don't know about you, but I assume it would make you feel, that makes them feel very relaxed instead of feeling very agitated. Same thing with cannabis. So that's why it's so important that you really know what your health issues are that you're addressing with cannabis. Prepared to ask a lot of questions. Yes. Yes, and one of the big problems that I've seen so much, and I see this in Canada all the time, is the people behind the counter don't know how to answer the questions. And that's a real problem. That's a very big problem everywhere. And one of the reasons that I spend so much time educating, and there's wonderful people. There's a young woman, young to me, young woman in San Francisco who I love dearly. She works with one of the dispensaries there. I'll say her name, Sarah Payan. She is she's doing a fantastic job of educating, the frontline, we call them bud tenders, so that they are able to understand, so that when a patient comes in, they talk to them and they can tell them what to use. Some of the information that I've heard coming from bud tenders, it just makes me crazy. I don't agree that it can't be standardized. The problem is the standardized medicines are inferior. For example, through Zelda Therapeutics, we're doing preclinical and clinical research. And one of the things that we've been studying is the use of pure compound THC and comparing it to whole plant, like something that I do, our medicines. And I've actually presented at Harvard Medical School on this last year now. And it's hands down, there's no comparison between whole plant and pure compound. They just work that much better. The synergy between them all, we call it the entourage effect. Raphael Mechoulam coined the term, but that's really what we use to show that together they have a much different effect synergistically than each of the compounds on their own. And so what a lot of companies are doing is they're using a distillate of the single molecule of one of the cannabinoids, like THC or CBD or some combination of them. And then they add in 2 or 3 terpenes, and they call it whatever the chemotype of the profile they're trying to emulate. Well, the problem is they're leaving out the other hundreds of components that actually synergistically work to make it work a certain way. But for people who don't have access to that, it's the difference between McDonald's or filet mignon. Both are going to give you calories. One's just going to be a lot better than the other. So if that's all you have access to, still better than starving. Yeah. Oh boy. So I like Karen said, I can't prescribe right now. Obviously, first of all, I'm not a physician. I'm a researcher and an engineer, and we have doctors who work for us at Calispring Wellness who will take a person and take them through a 300-point data, looking at all their medical history. They'll do an interview with them. They'll help them to understand what's going to work best, see about interactions, all of that. So for somebody that has a complicated medical condition, I built all this system and I did all this to put this in the hands of the medical community so that people can feel comfortable talking to their professionals about managing their health care. Fortunately, at this point, we have a little bit of, we have a number of doctors who've adopted this, the functional medicines, the naturopathic, some of the mainstream doctors. One of our former doctors, was a cardiologist, and he was recommending. So, I mean, it has become more mainstream. But if you're dealing with something that has to do with the immune system, which if you have rheumatoid, if I recall the question, without going into very specifics, anytime you're dealing with the immune system, you can always use a CBD product, which is going to have a lower level of psychoactivity. Even if it has some, it's going to be lower. And be careful when you're looking at medicines that say high CBD. I'm amazed how many times they say that, and it's a 1-to-1 of THC to CBD. It's just got a lot of both of them. So you want to have one. You still need to have a little bit of the THC. And the other thing is with the prednisone, you're going to want to take it perhaps at a different time. If you can talk to your doctor about maybe taking it earlier in the day and then having, taking the cannabinoid medicine closer to bedtime. At that time, you're going to want to have a THC medicine. And CBD actually has more of an interaction with the liver than THC does, with the metabolization. So you can get away with a little bit more THC in that case. But for during the day, for the symptoms, for the immune, a higher CBD, lower THC. Yes. I am a huge proponent of cannabinoid medicines for animals. I'll tell you real quickly about the story of my beloved Emma. I have a soft-coated Wheaten Terrier that I have had since December of 2005. And we bought her from a breeder, only found out afterwards that it was a puppy mill. Very, very sad. And so Emma, God love her, is the sweetest dog I've ever had, but she has such severe GERD, which is a gastric, it's a reflux where she has like a constant, vomiting and indigestion, acid. And she also has pretty severe hip dysplasia, which hip dysplasia would have obviously been bred out if it wasn't from a puppy farm. So the vet said this dog's going to be dead by the time she's 3. And we had her we had her in Colorado at CSU, the veterinary, which is one of the top veterinary schools. And they changed her diet. They put her on drugs. They did all the things. Nothing worked. And so we started giving her just a little bit of cannabinoid medicine, mainly THC. She doesn't really like CBD, but mainly THC. And we give it to her we give her about 5 milligrams of high-base THC medicine, and it's in an oil. And we just put it in the drops in our hand and she licks it off. She likes to do it. And once a day she gets about a quarter of a gram of raw cannabinoids, which is the THCA. THCA has wonderful benefits for the stomach, for the digestion, and the gastrointestinal. And as a result, she's walking on four legs, she's not vomiting, and she's a happy, happy dog. There are a lot of instances, especially as more and more locations around the globe become legal and have people just, cannabis 10,000 or more years old, but just having an awareness of it and having it be more mainstream. You have people that are, there's accidental overdoses with their animals. And the wonderful thing is that the animal feels horrible. That's not the wonderful thing. The wonderful thing is it's going to wear off and they're going to be fine. So as long as they are safe, and if you do accidentally give too much to an animal, make sure that what I've done when, because you have to, mistakes happen. You give them too much, or it reacts differently in this particular situation or another. You just make sure that you keep them close and you keep them safe and you let them sleep it off. I had an instance one time when we were first starting at Zelda's where we had bought some bottles that were defective, and we picked a bottle up, and the bottom of the bottle stayed on the shelf, and the bottle lifted up, and all the oil came pouring down, and it was a liter bottle because it was a storage one, and that was a mess. But besides that, we grabbed the Emma, but we still had another dog, Jeffrey, at the time, and we didn't get him quite as fast, so he got some pretty good licks up there, and he spent a very uncomfortable 4 or 5 hours kind of just shaking his head and staring off and being very frightened. So I just held him tight, and I took a big towel and I wrapped it around him tightly, and he was fine and went to sleep. But there are so many instances where using cannabis is, we've had patients that have used it on their animals. We've had animals that were the patient, and in many cases, and we have been truly amazed at the results we've seen in cancer treatments, pain management, intestinal issues, all sorts of things. I don't have as much experience with cats. I've treated a few cats, but I've treated a lot of dogs, for sure. That is a really good question, Kara. We've treated a number of pregnant women because they've had diagnoses of leukemia, non-Hodgkin's, we've lymphoma. We've had patients with other types of cancer while they were pregnant. We've even had women who are pregnant that had where the baby was sick. So there's different ways to treat it. There's been a study done in Jamaica that shows, it's a long term, that shows zero cognitive deficiency, and in fact, actually better responses from children that where the mother used cannabis during the pregnancy. It's very, very common and very effective to be used for things like morning sickness, et cetera, without damage, as long as it's clean medicine and you're not taking toxins in from pesticides and solvents, et cetera. Now, with cervical cancer, it may be that you're going to want to do something like a vaginal suppository, and also taking like maybe the CBD with less THC sublingually, because the endocannabinoids, anandamide is in the breast milk itself, which is the natural body form of cannabinoid or THC, like that, then obviously it's something that the baby is exposed to anyway, and so I wouldn't be as concerned. You have to weigh out the dangers to the fetus and the dangers to the mother and see which one, because to go through some of the more traditional treatments that are not available to a woman while she's pregnant, it may be what saves her life. Thank you. We love you, Kevin. Thank you, Kay. Now, Kay, I'm going to out her now, is the one who first gave me what she calls a puffy, a little puffy. And it was her boyfriend, now husband, is able to go through his life. You see this yourself, opioid free. That's just amazing. That's amazing because I mean, chronic pain. Anybody who suffers it, you're invisible sufferers. But as a chronic pain patient myself, I can just tell you, it is not pretty. It is a rough life, and if you can find relief that doesn't interfere with the way that you live, then it's worth its weight in gold. Right. Mm-hmm. Hey, Rob. Doc Rob. It's another one that we've met on this journey who interestingly came to cannabis recently. And I'm very excited to see what he's going to end up doing. I believe Rob's in Chicago. Yeah. Okay. Do you have any recommendations for anti-inflammatory terpenoids to administer cannabis for inflammation? Is it topical or internally via vaping or eating? Wow, that's a lot of stuff. Okay. So, very good question. So, as far as for anti-inflammatory terpenoids, there is a pretty comprehensive list that I will make sure that you have a link to, Karen, and we put a slide up that shows some of the benefits of the different ones because there are so many, and I am not a botanist or an expert. I know which ones do certain things to a certain extent, but after that, I'm not an expert by any stretch of the imagination on the effects. I have to look them up when I'm putting together to create different formulations. Um, yes. And then for administering for inflammation, I believe that it's not about for a particular, in this case, inflammation is systemic. So you have to treat systemically and not vaping or vaping or smoking might be very beneficial for very quick symptom relief, pain relief, very, you needed something now, not when it takes effect in 20 minutes to 2 hours. So how about you think about taking something for inflammation sublingually or buccal, which is in the cheek, going into your gums, where it goes directly into your blood supply. It's going to take a little bit longer to take effect than vaping, but it's going to be, number one, you're going to have a higher level of bioavailability, so it's a more practical way to do it. It's also more dependable on how long it takes to take effect. When you eat like an edible, I'm not a huge fan of edibles. I mean, they have their purpose in some cases, but when somebody's trying to treat something and they need to be able to depend upon a reaction, eating it is very inconsistent because it depends on so many other factors, like what have you already eaten? How tired are you? How hydrated you are? What kind of mood are you in? It can take, that's why you read about so many instances of people taking too much and having problems as a result of it is they waited 2 hours, nothing happened. So they thought, oh, well, I guess it didn't work. I take some more. And then it all hits at once. When you take something sublingually, you have a much more predictable how long it's going to be and what the bioavailability, how it's going to affect you. As far as topical is an absolutely fantastic option if you have localized, superficial. If you go and you work out and your muscles are engorged and you have inflammation or you bump yourself and it's whatever, then you can use that very well. But inflammation at a systemic level, you have to get much deeper than what's going to be in the first, outer layers of your skin. I use our topical, for example, for the inflammation I have in my hands from arthritis. I use it on my neck and lower back for when I have pain. It's a unbelievable what it can do if I feel a headache coming on, that to put it on my temples, to put it here. If I'm having a sag in my day, our topical, because of the essential oils in it and everything, are made to be more uplifting. I can put it here in the terpenes in it that I smell, because a terpene is something you smell, then are able to make me feel better in general. It's a complex medicine. So anything that you would use for inflammation, I suggest that you use for the most part internally, though. Thank you. Well, it's interesting because I'm actually speaking at a conference in San Jose on this very topic. And I'm actually in the process of doing some research now, and I'm treating it as an inflammatory medicine, or as an inflammatory disease. Now, just for those who are not familiar with this condition, it is truly one of the most heartbreaking conditions because of the chronic pain with no identifiable sources. These are people that are suffering with level 9, level 10 pain, and the doctors are scratching their head and saying, I don't know what to do. It's really heartbreaking to see the kind of suffering that this, and there is no test yet that says, oh, this is what it is. And for many years, doctors were looking at this diagnosis as a poo-poo, oh yeah, everybody has fibromyalgia, everybody has Epstein-Barr, kind of like they did with these other conditions. And as a result, you would go to a doctor and you would say, I think I have X, and they would laugh you out of their office or think that you're wrong because there is no such thing. Well, now it has actually been officially considered a rare disease, and actually does have diagnostics for it. There is no specific test that comes back and says, yes, you have CRPS, but it is still can be diagnosed more effectively. Using the higher CBD for the inflammation and using some of the THC as well for just relief. I mean, I personally could never make it through the day without THC. CBD, I could take or leave, but I need the pain relief of the CBD, of the THC. And then you don't have to become dysfunctional. I'm fairly functional running several companies, on THC. So this is an example of using it correctly and not overusing it so that you have to be altered in too much of a way. So I will, as I get more research done, I might have some more specific recommendations. I would certainly, if there is an area, like I've seen some patients where they might have like a foot or a hand that's very inflamed and very ugly, then I would suggest doing concurrently using some sort of a topical to help see if you can get some relief at the site. You're welcome. Love the picture, Kara. All right. Yeah. Hey, how are you? Now let's take a look at for a second where that was the logo from Cashy Hyde. Cashy was oh my God, he was the inspiration for so many of us. He, cancer has always been kind of where we've put a lot of our energy and efforts because, once you treat one cancer patient, then another cancer patient comes, et cetera, et cetera. But cancer is also very dear for me because of, all of my family dying of cancer. And so I'm very important. But Cashy Hyde was a little boy in Montana who was diagnosed with a brain tumor, and his father and mother became warriors to help save this child's life. And they did the research and they saw that they could use cannabis or THC-based medicines to try and kill the cancer. That there had been studies, there had been evidence showing, limited, but there still had been some. And the anecdotal evidence was overwhelming. And so they do it. Now, the sheriff came and broke in their house and took all their plants, stole all their plants. It became a big issue. And Cashy didn't have access to medicine. And they came to California for a while. And when he was 4.5, and then they went back without access to consistent medicine. And when he was 4.5, he passed away. And it was tragic, absolutely heartbreaking. And his family had set up the Cash Hyde Foundation to help other families for information and money, et cetera, et cetera. So I'm very grateful to Mike and Callie Hyde for leading the way in pediatric cancer, fighting it for the use of it with cannabis. And the lessons we learned from that hopefully will help to help many, many other children. Yeah. Good for you, Jim. If that's what does it for you, I've written articles more than once on the benefits of dabbing when it's done correctly, because you can get a completely measured dose. You can take it exactly. You can get instantaneous relief, and it'll last for X number of time. Smoking a joint is not quite as efficient because the bioavailability is much, much lower. It all goes directly to the brain. It takes effect right away, but then it wears off in an hour or two. And for people who have trouble staying asleep, it can be problematic. So you want to do something that's going to be more systemic, that you can get a longer term relief so that you can get 8 hours of sleep. And especially as we age, our sleep is more interrupted, but you want to have something that when you have to get up and pee 4 hours later, you're not so dizzy or discombobulated that you can't make it to the loo and back safely. But good for you. I hope it's clean medicine. Great. Yeah, I think she means Justin, but absolutely, yeah. Well, we feel the same way, Mallory. Where and when in San Jose? Actually, let me take a look at my calendar real quickly because I have not updated it. I know it's at the San Jose Country Club. And it is on the 24th of March. Yes. Oh, you know what? I don't have the answer to that, and I would suggest that you speak with either one of our physicians or one of our nurses. That is going to be, now I can tell you there is there's a terpene called borneol, and borneol does work as a blood thinner. It's in cinnamon. And so oftentimes I tell people, if you have a clotting disorder or if you're on medication for to clot, for clotting, etc., you need the same way that you would be watching what you would be doing with spinach or beets or anything that have vitamin K. You're going to want to watch the intake of your cinnamon-based things, or so, because of the borneol. The borneol is the actual terpene that's causing the blood thinning. But as far as treating a specific condition with blood clotting, I would think that needs to be under the monitor of a physician that understands cannabis and the pharmaceuticals. And that's right. Love you, Marcy. She's one of the nurses. She's one of the nurses that I just think is, she's leading the way in helping people and truly doing it for the right reasons and not just to become a celebrity in the cannabis world. She's really working with the patients, and I have a tremendous amount of respect for Marcy. If I could hire her, I would. I'd bring her here. Sure. My pleasure. Thank you so very much for having me. It's a pleasure, Karen, having this opportunity to do this with you.